My name is Associate Professor Jeanette Lee, and I'm the Vice Dean of Education at the Saul Sweehock School of Public Health. So today, Project UV Radiant Group has invited me to come and give a talk to you about their topic, and also to add on a little bit more information and to share with you the knowledge about UV sun protection and why basically it should be of importance to you. Okay, so what are the risk factors for skin cancer? The most common, and the one that we know of, is basically UV exposure. So that contributes about 95% of the risk. And if you want to think about UV exposure, generally in terms of the way we look at it, it's looking at lifetime exposure. So it's not just a one-off exposure, but often when we do research on skin cancer risk, we basically ask people who participate in our studies about how often they spend in the sun, and usually it's often grouped into different periods of their life, from when you're young to in your middle age and your older age groups. So the UV exposure is quite well known, and I'll show you some slides later on that even at young ages, if you have high UV exposure, it does increase your risk later on in life. And I think the other thing that we need to be cognizant of in terms of the environmental changes around us is that there has been a big reduction in ozone due to industrialization, of course, that has increased in the UV light in the atmosphere. And that basically makes the UV intensity much higher, which again increases our risk. There are other risk factors such as family history. So if you have a family history and parents or siblings, relatives who have skin cancer, it's really important that you are very much wary about that, and you also check yourself quite thoroughly. Your skin color is also another risk factor. So generally people who are of lighter skin tones, the classic example would be the people who are very fair skinned, they have blonde hair, blue eyes. The Nordic type populations have a very high risk, and the ones with the lower risk are the dark skin populations, such as Malays, Indians. And if you are the person who's predisposed to have multiple moles, that also does increase your risk. There are other less common risk factors such as arsenic and coal tar, which now in terms of occupational safety and health is a lot less common, but it does crop up now and then. And also in developing countries, this could be a risk factor for skin cancer. So there are other effects which are a bit more immediate, and I'm sure some of you may have experienced this, but it's a painful sunburn. So again, if you've been out long enough, you can get a painful sunburn, and to the point that it's really even hard to sleep at night. If you've been out in the sun a lot, you can't even lie on your back, right? So it's quite painful. So that's not a very pleasant experience, although I guess some people tend to live with it. The other effects, which maybe will happen a bit later on in life, and for those who are a bit more conscious, is it could lead to nasty pigmentation, and it could also lead to premature aging and wrinkles. So of course there are many people who are in the cosmetic business, and there are doctors who also are in this line, and there are treatments for this and all that which could help from a cosmetic perspective. But I think in terms of from saving money and maybe having to avoid all these procedures, it's best to avoid and do have some sun protection. Okay, so some things are just to check for. If you notice, this is again another acronym for easy memory. We go by A, B, C, and D. So, and essentially is to show you that there are some characteristics to show that maybe something is not quite right with a mole, and this is more in terms of melanomas. So a normal mole tends to be quite nice, round, symmetrical in nature. If you start to see changes such as asymmetry, so it becomes irregular in shape, then I think you need to be wondering if there's a problem happening. If the borders start to change, so again the edges, the borders tend to be very nice and smooth and demarcated, but if you start to see that the shape and the border starts to change, and the color starts to kind of creep and get bigger, then it's important again to seek help. The color again, so generally the color is fairly well defined, it's fairly homogeneous. But if you start to see changes in color, different tones, because it all be kind of black and brown in nature, but you start to see changes, or if it starts to bleed, then you again need to seek help. And the diameter would basically be the size. generally something that's, fairly small and has never changed over many years is probably okay. But if you start to see changes and it starts to grow quite big, quite quickly, again, I would seek help. Because again, it's at this point when it's caught early, easy to remove. And in terms of removal, it would be a surgical procedure. So if we can catch it small, the scar will be smaller, and that would be much better also for you, for everyone, right? Because you don't want to be stuck with a nasty scar either. Okay, so in general, I mean, the main thing is really to avoid sort of constant sunburns. I mean, if you get sunburned a few times, maybe that's okay, but I think try to get out of the habit of having regular periods where you keep getting burnt, because it's an additional lifetime, so the risk is kind of cumulative. Okay, again, it does depend on your skin tone. So people who have very pale skins can burn very easily, probably within 15-20 minutes. But this is assuming you've got very high sun exposure, and it's very on a day where the UV light is very intense. But whereas people with, say, darker skin tones, it would take them longer to get burnt. I think the trick here is really it's important to remove sunblock. So there is a perception that yes, sunblock can lead to acne, but what is important is, yes, you need to apply the acne to have your sun protection, but after you finish that activity, after you go home, it's really important to wash it off. Okay, well, it's been a pleasure talking to you all, and I hope to maybe see you again sometime, perhaps. So, thank you.